my name is Megan Winship, and I'm an occupational therapy student at Tennessee Wesleyan University, and I'm going to talk to you about how occupational therapy can benefit pregnant mothers throughout their pregnancy and after.
Occupational therapy during and after pregnancy. My goal for you guys today is just to learn how occupational therapy can benefit you as expecting mothers and also those that are already mothers. Some of the objectives for this education session is just being able to define what occupational therapy is, how occupational therapy can benefit expecting mothers, different co-occupations that you may participate in that OT can help, how to address role overload, mental health in pregnancy, strategies for successful pregnancy, and then also how we can help you even after your baby is born. So first, I want to take a minute for you guys to discuss about occupational therapy, and if any of you have experienced occupational therapy, to share that with the people you're around. So it seems that a lot of people don't really understand what occupational therapy is, and I thought that this video that I'm about to play will be a great way to introduce you to occupational therapy and understand all the areas that we can help people in and what we can do to help benefit people's lives.
What is occupational therapy? Occupational therapy helps people do the things they want, need, or are expected to do. We call these important activities occupations. These are the meaningful things that people do to occupy their time. For instance, getting ready in the morning, going horseback riding, reading the newspaper, having lunch with friends, watching videos on YouTube, feeding your child, playing in the sand, taking care of your pets, driving to the store, doing laundry, taking a well-deserved nap, going to church, doing your homework, or working a job. Sometimes people encounter roadblocks in their lives that keep them from doing these meaningful occupations. Maybe someone became injured or has a disability, or maybe they're just getting a little bit older. So, what do occupational therapists do? Occupational therapists help people move past these roadblocks so that they can participate in the activities that are meaningful to them. Occupational therapists help people with self-care, managing activities within their home and community, rest and sleep, education, work, play, leisure, and social participation. They work with people of all ages in all sorts of settings, at people's homes, in the hospital, in rehabilitation centers, in clinics, in schools, in skilled nursing homes, and out in the community. Occupational therapists take into account the whole person, including their values, beliefs, and spirituality, and the social, environmental, and cultural context of their life. So what does this look like? Well, an occupational therapist might help John, who's getting older, to make changes in his house so that he can live there longer. Another occupational therapist might help Sally, a woman with schizophrenia, discover new and meaningful occupations that make her life more rich. Samir, a child with autism, might work with his occupational therapist to make friends at school. Or an occupational therapist might help Raquel, who had a spinal cord injury, to drive again. Often, occupational therapists not only help people participate in their meaningful occupations, but they also use these occupations as a way to help people reach their goals. For instance, when an occupational therapist works with Mary, who had a stroke, to feed herself at the hospital, she gets more coordinated with every bite. And when an occupational therapist works with Miguel, who had a shoulder injury, to pick up his daughter, his shoulder gets a little stronger. To occupational therapists, being healthy is more than not being sick. It's about being able to live your life to the fullest.
So just to reiterate what that video talked about, occupational therapy helps individuals to be independent in their daily activities. Occupational therapy can be applied in many areas in different stages of life. It can be useful in birth all the way up until death. Many individuals will face some sort of disability in their life, and OT is here to make sure that it doesn't stop you from living your life. And I just wanted to talk about how useful occupational therapy can be for you guys as expecting mothers. So, what are some ways that OT can be helpful for expecting mothers? Some of the topics that I'm going to talk about in this session is health and well-being, workplace ergonomics, transition into motherhood, and then helping your baby after it is born. These are just a few areas that occupational therapy can help you as expecting mothers, and there are many more that can also be helpful. Health and well-being. So there are many areas that can be addressed to help your health and promote well-being during the stage of your life. Two areas that will be discussed are mental health and then co-occurring illnesses. 1 in 5 women experience depression or anxiety during their pregnancy. According to the CDC, postpartum depression is experienced in about 1 in 9 women. This varies by state, race, ethnicity, and age. As OTs, we want you to know that you're not alone when it comes to your mental health. OTs can help you manage your mental health while promoting your ability to engage in your normal activities. The next video I'm going to show talks about anxiety and depression that many women face during pregnancy, and it just talks about the importance of getting this out there that many women face this and you're not alone, and that it's okay to be depressed and have anxiety while you're pregnant, but it's not okay to just keep that bottled up and afraid to tell people. So this video is just going to go into some details about that.
Today we're talking about perinatal mood and anxiety disorders. We usually think of pregnancy and the time when we bring baby home as a really happy time, and it is for most women. But for about 1 in 5 women, this is a time that's really challenging because they are starting to experience symptoms of depression or symptoms of anxiety. It's important to recognize that this does not mean that you're a bad mom, but in fact, this is one of the #1 complications of pregnancy and happens to a lot of women. So for depression, it's usually something that is experienced as sadness that lasts for days, not just for brief moments in time. Also, you can experience feeling things that usually are joyful are no longer joyful. You don't enjoy doing the things you normally like doing. You might have trouble sleeping, you might not have any appetite, and you might experience profound fatigue. The great news is that we have really good treatments for depression, both during pregnancy and after. That include talking to a therapist or a counselor, talking to your obstetrician who can provide medicine if that's what's best for you and your baby. About the same number of women also experience anxiety, and that can mean excessive worry, worrying about everything under the sun. Or it could be very specific fears that you have, like fears of harm coming to your baby, which happen to a lot of women. But anxiety can be really debilitating for some women and can even include symptoms of obsessive compulsive disorder. And those include obsessions, which are recurrent thoughts that you can't get out of your head. Things like fearing germs or fearing that you're going to be contaminated if you touch things. And those are often followed by behaviors that we call compulsions that you do to try and make those fears go away. So for some people, that's washing their hands excessively or cleaning the house over and over again. While a lot of people experience anxiety normally, when it gets to really interfere with your daily life, it's something that you should seek help for. Now, a lot of women that I talk to who have been experiencing symptoms of depression or symptoms of anxiety tell me that they actually started during their pregnancy, but they didn't feel comfortable telling anybody. What we really want to let people know is that these are very common, and it doesn't mean that you're losing your mind. It just means that physiologically something is happening in your body that happens to a lot of pregnant women or women after they have a baby, and that is causing your brain to not function the way it does normally. So we would encourage everyone who is experiencing these symptoms to talk to your family about it, talk to your doctor about it, and to feel comfortable getting help. Because the good news is that when women do get help for these symptoms, not only do they feel better, they tell me that they also interact with their babies in a much more enjoyable way. And we know that that helps the infants develop better over time.
So this video talked about different areas in mental health that are frequently seen with pregnant women and different ways that you can receive help or talk about your issues that you may be experiencing. So occupational therapy, though, for mental health, we can help address your needs. If you're experiencing postpartum depression or anxiety, like the video said, we can help you find support groups. We can even lead support groups for you and others. Through these different groups, we can teach you methods to reduce your stress. We can help teach mindfulness education and exercises. This is a great way to de-stress before different activities that you might need to engage in or before working or taking on any tasks. There are many videos out there on YouTube and other sites that have mindfulness exercises. It just helps you to take a step back and clear your head and mind. Another way that OT can help teach you to reduce your stress is learning new activities to engage in. There are many studies out there that show that different leisure activities can help reduce stress, such as yoga or exercise or anything that calms you. This could be a great way to help reduce your stress and anxiety during and after your pregnancy. Another area that OT can address with promoting health and well-being is co-occurring illnesses. Many women during pregnancy have other illnesses that might go on as well. One commonly experienced is carpal tunnel or arthritis. Carpal tunnel is when the nerve in your wrist gets pinched, causing numbness and tingling in the hand. The picture over here to the right shows where the carpal tunnel is and the nerves that go through the hand, and you can see how it can affect the whole hand when this gets pinched. This has been reported to be experienced in 62% of pregnant women. This is usually in the third trimester, but if seen earlier, it can be more serious and harder to treat. With this illness, and as well as with arthritis, occupational therapy can help teach techniques to ease the pain. Fatigue is commonly experienced with these diagnoses, as well as just pregnancy in general. So we can help address this by finding different ways for you to conserve your energy. We can help you plan out activities or make a schedule so that you're not using up all your energy at once. OTs can also help find alternative ways for you to participate in your occupation so that you experience less pain and are safe. Workplace ergonomics. So many of you wish, I know, to still work as long as possible while you are pregnant, and we understand how this is a need to be able to provide for your family, and that it can also become increasingly difficult as you are pregnant. And so one way that OT can help make this easier for you is we can make adaptations to your work environment to promote safety and comfort while also allowing optimal performance. So we can actually go into your place of work and assess the area and make changes to suit your needs. Say you work at an office job, we can go in and see how your desk is laid out, your seat, and make changes to the arrangement of objects on your desk. We can change or make suggestions for different seats or cushions to help better posture and comfort for you. We can also teach you about proper body mechanics and postures to keep you safe throughout whatever your job entails. Assistive technology. So what is assistive technology? Assistive technology, or AT, are devices that can help individuals be able to participate in their daily activities. These are commonly used by individuals with disabilities in the older population, but it's not limited to anyone. Expecting mothers can benefit from this greatly, And I'll show you a few soon in the next slide, different ones that can benefit you. We understand that complications may arise during pregnancy, and so AT can actually be useful as these complications may occur or just as your belly's getting big and things become difficult. Assistive technology can be expensive, but we want to promote something that is useful to you. So there are many low-tech items that you can use since we know you won't be pregnant forever and we don't want to burden you anymore. So how can AT benefit you? So I have in these pictures a few different assistive technology devices. Lots of them help you get dressed in the morning, and I know this can be difficult as you're getting bigger. And so the top left one is a sock aid. And as you can see, this helps you put the sock on one end and you slip it on easier, so it reduces you having to bend down as far to grab the sock and put it on your foot. Below that is a shoehorn, and this helps you to get your shoes on easier. And so these just help it, especially if you're alone and don't have anyone to help you, and it can be really hard. These just help it to make it easier to get dressed in the morning. And I know some mothers have, and some of you may be worrying about and watching varicose veins, and you have to wear those tight compression socks. And so sock aid can be really helpful to get those on since they're already difficult without a pregnant belly. Another item that can be really useful and is fairly inexpensive is a reacher, which is on the top right. And this can help you reach items of varying distances and reduce you having to be able to reach and grab it. This can be useful, say, if you drop something. I know it can take a lot of energy to have to position your body to reach down and grab it, so this could reduce that. It can also help with cleaning, reaching stuff at high cabinets and make you stay safe without having to reach up high. And so there's many useful ways this could be used, and you can typically find this in even normal stores might carry it. Another item that I wanted to talk about are wheelchairs. This is an assistive device that we can give you and promote to use, especially for mothers that might have more high-risk pregnancy. And I know lots of mothers may be bedbound near the end of their pregnancy or throughout, depending on how high risk they are. And so that typically means that they just don't want you to engage in activities that require a lot of effort. And I know it can be hard to stay in bed all day. And so a great technology to help reduce you having to use lots of strength is a wheelchair, so that you're still able to get around and do stuff without much effort. The transition into motherhood. Many mothers can experience difficulties with this transition, especially if it is your first child. It can be a huge adjustment. So as OTs, we want to help make this adjustment smooth and as less stressful as possible. We want you to still be able to go back to all your activities, even though you now have a baby, or even in the transition to having a baby. We want you to still be able to engage in everything that's meaningful to you. One way we can help you in this area is adjusting activities to fit your new schedule and needs, and help you how to learn to do activities with a child. I know with this transition, it can be overwhelming, and so having the adjustments to fit these new needs can be really beneficial since it is such a big change. So one of the co-occupations that I wanted to briefly discuss that you engage in as a new mother is breastfeeding. And so if you didn't know, co-occupations are occupations that involve another person. And breastfeeding benefits the baby and the mother. For the mother, it can mean faster return to pre-pregnancy weight, decreased obesity, osteoporosis, and breast cancer. For the baby, it has nutritional, immunologic, and developmental benefits, as well as anti-inflammatory benefits. Occupational therapists commonly address feeding in many settings. We can help support infants that are at high risk for feeding difficulties. And I know this is an area that many mothers struggle with, and just wanted to let you guys know that you're not alone. We can find and help different techniques to help promote breastfeeding with you and the child and that engagement. We also understand that not all mothers are the same and that breastfeeding isn't for everyone, but we can help address other feeding issues too, such as if your baby is having difficulties with a bottle. Role overload. So in case you didn't know what role overload is, role overload occurs when individuals are subject to too many role demands and have too little time to meet them, which hinders their ability to address all the demands, resulting in frustration. Role overload is very common with new mothers. You're now taking care of the baby while taking care of yourself, your family, working, managing your house, being a friend, cooking, and all these different activities and roles that you take on every day. And so one way OTs can help is just helping you manage these different roles and occupations that you're involved in. We can help reduce the stress by helping you learn different time management, prioritizing what's important. I know it's hard. You make a list and you want to get everything done that day, but sometimes it's not possible. And just understanding and knowing how to prioritize what to get done each day can be really helpful and not overloading you, making you more stressed out. So OTs can help in many different ways with helping manage this. So I also wanted to briefly talk about other areas that occupational therapists can help you after your baby is born. There are many different areas that OT address, and one is with babies. And so the two areas that I wanted to talk about that, just to get you more informed on these different areas, is the NICU and early interventions. I understand that many of you might not need this, but it's just a good way to be introduced to it, especially if you do need it, that you'll have knowledge about what it all entails. So OT in the NICU. The NICU, or Neonatal Intensive Care Unit, is the place where babies can be placed if they are born premature or may be unstable and need more care. According to March and Dime's study, 14.4% of newborns had to go to the NICU. So there are many different ways that OTs can help you and your baby during this situation. I understand it's very stressful in the NICU and you just want what's best for your child. So different ways that OTs can help you and your baby is positioning, recognizing signs of stress and ways for you as a parent to interact and take care of them and help reduce this stress, strengthening your baby and just their muscles and being able to stretching them and engaging their body. Sensory is a huge area that OTs address in the NICU. Many babies that are first placed in the NICU are very sensitive to the environment, and so as therapists, we can help adjust the environment to help your baby to promote growth and comfort. One thing that's very important in this setting is everyone that works together, the whole team, we have to work together and communicate not only with other team members, but also with you as parents. It's very important to engage the parents and let them know throughout the whole process what is happening and why it's happening and how it's all benefiting your child. Another area is early intervention. Early intervention services and supports are typically provided to children under the age of 3 years and their families. This is an area where OTs can address your child's needs in your own home with you involved. One study has showed that infants and toddlers learn best through everyday experiences and interactions with familiar people in familiar contexts. This is why it's so important for OTs to go into the home so that the child's guards are up, they're comfortable, and they recognize you and the different surroundings to help them in the areas that they're experiencing difficulties. So OTs can help your child if they're experiencing difficulties engaging in different occupations. And I know you might think, well, what occupations does my 3-year-old have? And so these occupations can be things from playing, eating, dressing, sleeping, even early education. I know for 3, it's not any intensive education, it's more communication and social skills and just those cognitive abilities to prepare for when you actually go to school. This is very useful to help your child reach different milestones, especially if they may seem behind developmentally, and just helping them reach those so that they promote growth and optimal performance and well-being throughout. So I just wanted to recap about what all I've discussed so far. So occupational therapy can help you in so many areas of your daily lives. The main goal of this field is just to make sure that you're able to enjoy and engage in activities that are meaningful to you. As expecting and current mothers, we want to make sure that you're able to engage in the different roles that you take on and that you can achieve them to the best of your ability. We want to advocate for you and to make sure that you're comfortable and safe throughout this journey. So as I talked about it, there are so many areas that we can help you in, and there's more that I haven't even touched on. Lots of mothers don't know about occupational therapy and that how we can help you throughout this time. And so it's just really important for us to get the word out and talk to you and let you know that we're here and that we can help you achieve and do so much during this time. So I just wanted to say thank you for listening to this education session. I hope that it was informative and helped you understand how occupational therapy can help you through and even after your pregnancy. I hope that you learned something new. And if you have any questions or concerns, feel free to email me. Just let me know how you thought this presentation went. Or like I said, if you have any other questions that I can answer, don't be afraid to email me. And then here are some references so you can see where I got my information throughout this session.